Today, we are going to tackle a topic that affects literally millions of women, but is still so often misunderstood: perimenopause. We're going to break down the hormonal shifts your body goes through and take a look at hormone replacement therapy as one potential way to navigate them. So let's dive right in.
I want you to think of your body as this incredibly complex, fine-tuned communication system. So, what happens when the key messengers in that system, your hormones, start to go a little, well, off script? What happens when they send mixed signals, or worse, just stop sending messages altogether?
That's where hormones come in. They're these essential chemical messengers, always working behind the scenes, making sure everything is running just right. When they're all in balance, you feel great, but even a tiny little shift can throw the whole system out of whack. And that brings us right to the heart of the problem: trying to decode the signals your body is sending during perimenopause. This is the phase where those hormonal imbalances really start to show up in some noticeable ways. A lot of people use the words perimenopause and menopause interchangeably, but they're actually very different. Here's the deal. Menopause is technically just one single day. It's the day that marks 12 months since your last period. Perimenopause, on the other hand, is the entire journey leading up to that day. And it's during this long transition that the symptoms are often at their worst. And when I say journey, I mean it can be a long one. For some women, this whole symptomatic phase of perimenopause can last for up to a decade, a full 10 years. That is a massive portion of your life to be dealing with symptoms that can be really disruptive. So what are these symptoms we're talking about? Well, as your body's production of estrogen and progesterone starts to decline, it can set off a whole host of issues. You've got the ones everyone knows about, like hot flashes and night sweats, but there's also things like brain fog, anxiety, trouble sleeping. The list is long, and it really affects you both physically and mentally. And this really gets to the core of it, right? We are not just talking about minor annoyances here. These are symptoms that can fundamentally get in the way of your work, your relationships, and just your ability to enjoy your day-to-day life. Okay, so now that we've kind of defined the problem, let's talk about the turning point, a potential solution. This is where hormone replacement therapy, or HRT, comes into the conversation. The idea behind HRT is actually pretty simple. If the problem is an imbalance of your body's messengers, well, the solution is to help restore that balance. It's a treatment designed specifically to tackle those disruptive symptoms by topping up the very hormones that your body isn't making as much of anymore. But HRT is definitely not a one-size-fits-all kind of a deal. It's much more like a toolkit, with different options designed for different needs, and understanding what's in that toolkit is absolutely key. Broadly speaking, HRT falls into two main buckets. First, you've got estrogen-only therapy. And then there's combination therapy, which uses both estrogen and a synthetic form of progesterone called progestin. The right choice for you really depends on your specific health factors, like, for instance, whether or not you've had a hysterectomy. Estrogen therapy itself is super flexible. It can be delivered in a bunch of different ways. There are the common daily pills, there are patches you wear on your abdomen, there are topical creams and gels, and even really targeted vaginal applications for specific symptoms. Combination therapy is a bit more streamlined. It's usually delivered either as a pill, kind of like oral birth control, or through an intrauterine device, an IUD. This combination approach may also help reduce the risk of endometrial cancer, which is another important factor. So, if we put it all together, you can really see how varied the options are. From daily pills and patches to creams and IUDs, the main thing to remember is that treatment can be highly personalized. The right delivery method and the right therapy type can be tailored specifically to your symptoms and your lifestyle. All right, so we've covered the problem and we've looked at the potential toolkit of solutions. So what's the next step? How do you actually move forward with all this information? And this, of course, is the million-dollar question. While HRT can be a really effective treatment for many, it's so important to know that not everyone is a candidate. The decision really comes down to your personal medical history and your current situation. This is such a critical point. I mean, for way too long, the message to women has basically been to just endure these changes, to tough it out. But that just doesn't have to be the case anymore. There are real options out there that are worth exploring. And this is the key takeaway, really. The single most important first step you can take is to just talk to a qualified healthcare provider. They're the ones who can look at your specific situation and help you figure out if HRT, or maybe another path, is the right one for you.
So we're going to leave you with this question. Now that you're armed with all this knowledge about perimenopause, its symptoms, and the different HRT options, what questions are you going to bring to that conversation to advocate for your own health? Thanks so much for joining us.